What nerve is identified by the pink arrow? This is a subtle finding on this coronal non-enhanced T1 weighted MRI, but it's important to distinguish this nerve from the more commonly known nerve shown in yellow. The answer is the posterior femoral cutaneous nerve, also known as the posterior cutaneous nerve of the thigh. It is a sensory branch of the sacral plexus. It's important to distinguish from the sciatic nerve shown in yellow. It arises from the anterior and posterior divisions of the anterior rami of the S1 through S3 nerves. The posterior femoral cutaneous nerve is one of 6 branches directly off the sacral plexus. It supplies the skin of the posterior thigh, buttock, and the posterior scrotum/labia. Interestingly, it provides the greatest surface area of supply of any cutaneous nerve. Here's another image showing just what we're talking about. In terms of its course, it initially emerges lateral to the anterior sacral foramina and lies next to the psoas muscle, underneath the muscle's parietal pelvic fascia. It then travels laterally into the greater sciatic foramen, where it exits the pelvis below the piriformis muscle. Within the gluteal region, the nerve is situated underneath the gluteus maximus muscle and overlies the sciatic nerve. It then descends superficial to the long head of the biceps femoris in the posterior thigh, where it's deep to the fascia lata. This fascia is then pierced by the nerve in the popliteal fossa, terminating with twigs joining the sterile nerve. There are 3 branches of this nerve, and those include the cutaneous branch, the gluteal branch, also known as the inferior cloneal nerve, and the perineal branch. Again, it's important to distinguish this from other pathologies such as sciatica, because this nerve shares many similar pelvic parasympathetic nerves. The presentation of pelvic pain can be similar. You now know a lot about the posterior cutaneous nerve of the thigh. Please subscribe for more awesome anatomy and radiology videos.